Well, September is Cholesterol Education Month, when doctors, medical facilities, they will often bring awareness to risks associated with high cholesterol levels and how to avoid them. The most common advice is to maintain a healthy diet and active lifestyle to avoid cholesterol buildup in the arteries, which will lead to a possible blockage and heart attack. But SouthCoast Health Cardiologist Dr. Abdul-Razaq Adeniyi also stresses the importance of regular cholesterol screenings, saying that should start at an earlier age than most people expect.
All adults over the age of 18, and I would say definitely over the age of 40, should make sure they're getting routine cholesterol checks every 6 months or so to ensure that those values are within appropriate range, and if they're not, they're working actively to get them, taken care of. That's the most important thing. I also use this month in general to focus on just optimal cardiovascular care, sort of re-emphasizing the importance of good lifestyle habits, dietary habits, regular cardiovascular exercise, and doing everything we can to keep those arteries nice and clean. It's important because cholesterol plays such a large role in the development of cardiovascular disease, specifically atherosclerotic disease, which is the #1 killer of people in the United States and actually a large part of the world. And so getting the awareness out there so that people understand why it's important to get their cholesterol checked and make sure all of those values are within normal range ensures that we make sure we take care of as many patients as possible, because prevention really is the key at the end of the day.
Well, Dr. Adeniyi says people over the age of 40 should consider having their cholesterol checked every 6 months, certainly every year, but he says 18 is not too early to start having that cholesterol checked.
Yeah, I think that's so important, and even reiterating the lifestyle habits that we can change, the eating habits we can change.
Yeah,
definitely a good reminder.
There are people in high risk people who should be like family history or something like that. If heart disease is prevalent in your family, you should probably start at 18, and you should definitely do it more than once a year.
Wow, yeah, that's good to know for sure.